This is Fran from Dr. Gashinsky's Holistic Dental Center, and thank you for coming to this incredibly interesting and well-needed webinar tonight. We have great information to share with you. We have three amazing doctors. One is trying to get into the room, that's Dr. G. We have Dr. PARVULESCU and Dr. Sonners, both here, who are going to get everything started, and I'm going to talk to you about some of the things that they are going to share that is going to help you tremendously during this time of COVID and then after. And we're going to get started introducing both doctors for now. To get started, we're going to start with Dr. Drs Sonners. He is an amazing chiropractor, has a great wellness center, Core Therapies, along with his wife, Melissa. And he has the distinction of having something that only 250 people in the whole entire world have. And I'm going to have Dr. Sonners explain that to you. Please give us a little bit of information about who you are and what you do.
Sure. Yeah, so we have a clinic in New Jersey. We actually have another one outside of Philadelphia as well. We focus on quite a few different aspects of health. And it's not just my wife and I. We have quite a few other practitioners. So we have chiropractic, we have functional medicine, hyperbaric oxygen, acupuncture, massage, counseling, exercise programs, nutrition programs. So, I mean, we encompass, quite a few different areas of healthcare. Certainly, we don't hit it all, but we do try to find, other healthcare practitioners that have a very similar mindset to us on, the global picture of how to care for people, how to care for people's families. And we've been lucky so far to find a great team of people who can help us cover such a wide range of both ages in terms of, treating, let's say, infants and pregnant moms to, treating parents, grandparents, and the whole bit. So it's been really a great experience for us. And like I said, we've had a great opportunity to serve our community for maybe the last 16 years or so. So.
Wonderful, wonderful. But what is that distinction of that?
So I
specialize
in like a very specific type of kinesiology and functional medicine. So it's a very detailed analytic and diagnostic process to go through with patients to mostly so that we're not just focusing only on what patients feel, like what their symptoms necessarily are, but we're also digging a little bit deeper, covering a multitude of avenues to make sure that we're uncovering their whole picture, so that we're really able to get to deeper levels where the causes are, not just where the effects are. Really helping people get healthy at a deeper level.
Exactly. And that is such an amazing thing, because that's how we like to practice in our alternative or holistic world, is that treating the cause, not just the symptoms. We don't want to put just Band-Aids. So that is an amazing way of practice. And we found Dr. G. We just have to get him unmuted. So while we're getting him unmuted, we're going to say hello to Dr. PARVULESCU, who I have to tell you, I am honored beyond belief to have him here, because he is one of the premier doctors practicing the way he does. I'm going to say I'm a little bit of a groupie, because he actually has trained at Paracelsus Clinic in biological medicine, which to me is like the pinnacle of holistic medicine. So that being said, I'm going to have him give you a little bit more information about what he does. And actually, doctor, I'm going to brag a little bit. I actually started my plant-based diet 2 weeks ago, and I feel amazing. And I can't say enough about it. So I'm hoping that we'll continue, and I'll have to pick your brain a little bit later. But please let us know about what you do a little bit more.
Well, thank you for having me. I'm very honored to be here the second time around with you.
Absolutely.
So I am a doctor that originally come from Romania, and I passed my boards in the United States. I am trained and board certified in internal medicine, and I've been practicing in northern New Jersey for over 20 years. I am trained in multi-facets of integrative medicine, and this would be my approach no matter what I discuss with the patient about. And I'm full board certified in functional medicine. So I also practice acupuncture, and I have training in Chinese medicine. I have been educated in biological medicine at Paracelsus Institute in Switzerland. So this is what I do.
Yeah,
So I
sounds
am
like-
also, pursuing Qigong and other modalities, which I can advise patients about in different varieties. And my office is now in northern New Jersey, in Madison, New Jersey.
Very good. And again, we now have Dr. G. Thank you very much, Doctor. And Dr. G, you have to be unmuted. We have to unmute you, Doctor. Let's see if I can unmute you. Can you unmute yourself, Doctor? Dr. G? Yes, you can. Go to the bottom.
Myself because you mute.
There you are. All right. Dr. G,
Yeah.
let's hear exactly who you are. We all know Dr. G, but I'm just going to give a little bit of a brief introduction. Dr. G has been my mentor and my impetus for continuing my holistic lifestyle. If it wasn't for him, I wouldn't be where I am now on many levels. So that being said, he not only takes care of his patients, he takes care of many other people outside of that, because he's dedicated to his craft, as you both doctors are. So that being said, Dr. G, I'm going to have you explain a little bit of what you do and how you do it.
You know that first of all, I'm dentist, and I become holistic dentist 20 years ago. Everything changed around me, and you know that I started attracting wonderful people, because you know that way of practicing dentistry, it's the same, it's a little bit different. You need to just involve a lot of modalities. You have to educate it yourself. You have to go for continued education, for a lot of training. I'm holistic dentist for 20 years. I'm nutritional consultant for probably 18 right now. I have a board certification as a therapeutic doctor. And basically, I'm involved in holistic dentistry. I'm trying to work as many practitioners as possible, because you cannot do everything alone, and you need a team of group, good people just surrounding you in order to help patients. Office is multifaceted dentistry, regular dentistry. You know, we're starting with a cleaning. We're doing everything necessary. We just taking care of mercury fillings if patients choose to remove it safely. If they have infection around the root canals, we're dealing with this too. Office placing ceramic implants for more than dozen years. You know that, and we have quite a success healing patients. You know, we using ozone extensively in the office in multiple ways. You know, as a gas, as a water, as an injection, you know, different ways. And ozone is imuse me every day the power, and you just make it works better. And it will really, really help us to protect patient and ourselves from COVID-19.
Exactly. And I have to say here, I'm fangirling out here. I'm amongst three amazing doctors with such great experience and great knowledge. I appreciate, and I'm very humbled to be able to moderate this webinar. So we're going to get started, and I'm going to ask a general question just to get started, and that is, over the past few months, what have you been experiencing to be the biggest challenge with your patients? I'm going to start with you, Dr. Sonners.
You know, I think amongst the obvious in terms of the actual virus itself, you know, fear and stress are probably the two biggest hurdles that I feel like patients are really dealing with. You know, our lives in so many ways have been altered, to say the least. You know, we have little kids, so school is very different. Our work environment is different. The protocols that we need to go through as a clinic are obviously changing. And then, you know, patients' responses to this changing environment too has been difficult. And, you know, to some degree, maybe we're lucky, maybe we're not, but when you have an understanding of a little bit more of the biochemistry and the immunology of what's going on, you might be able to make more sense out of some of the things that have been going on. And when that's not your background and you're just relying on, kind of what you hear, whether it's, on the news or friends and family or close friends that are doctors, I think there's a lot of contradictory information that's out there. And I think there's a lot of, there's just an overwhelming amount of information going on right now. And I think it's leading to a lot of increased, obviously, fear. And it's having patients have a difficult time managing their new life, their health, even before this may have been challenged. And certainly now as a result, even more challenged. And I think breaking through some of those barriers on helping people to understand a little bit better about what's going on. It's one of the reasons I wanted to do this with you guys today is, if we could understand this a little bit differently and maybe have a greater understanding of what we could be doing for ourselves in this time so that we don't have to be as fearful of what's happening. We can gain just a little bit more control, in a time where we feel like we've lost a lot of control. If we can focus on some of those aspects and really recapture some of that, I think, it can go a long way for how we feel in our own lives and with our families.
Absolutely. I agree with you 100%. Dr. Parvulescu, you see that in your practice too? Do you find that, or do you have more challenges, or do you see that a lot also, the fear and the confusion?
Yeah, so I think Dr. Sonners, brought the issue of fear and stress, and I would encapsulate and say that the whole community is presented with a new unknown. So when you have the flu epidemic, which is recurrent every year, people were preparing, the community was preparing in some way or another, and most of us would be walking around, and doctors in the offices and in the hospitals say, well, you get the flu shots, and if you have asthma, COPD, or you have many other comorbidities, people say, well, I know there's a risk factors, but the doctor is taking good care of me. So what I think is happening now is that this is a challenge that doesn't necessarily come only to the community, but is a challenge to the person itself, because what you hear every day drummed from the TV and every single media is that there is somebody out there to get you. So right now there is a question that not the classroom has to answer anymore, meaning the community, but everybody has to give an answer, and people are afraid because right now they have to step out of the classroom and they have to give an answer themselves. However, the media says that this is a problem which has to be resolved in the sense that community and this new question has to be formulated and dealt with in such a way that the individual doesn't have an appropriate answer. In that sense, the individuality is something that is very challenged, and because there is a big unknown, I see that most of the patients are very, very taken back, and they are hiding instead of trying to confront the reality of their lives. So this is what I see in my patients. And if you want me to give you an example, that would be right now what you see with the reopening of the schools. People are told, well, here's the schools, they will be open, you guys make the distinction. So each single day you see that the teachers in the classrooms are throwing their hands up, and the administration of the school is throwing their hands up and says, I don't have the answer to this. I don't have the facility to deal with this. There are legal issues where the kids and the teachers won't be able to deal with this. So in the face of unknown, we see overall capitulation on the part of the individual. So in that sense, the responsibility of the individual now, it's given back to the community. So somebody else is driving the bus. Everybody has to sit in the bus and stay quiet. And I think that you can only hide for so long and for so much. So I do see in my school that there are, for example, some patients that I know that happen to go to the school where my kids go. And this particular patients have a way of looking in terms of taking responsibility of their life on a day-to-day basis. They already made a decision for the kids that kids should not go to school because they're afraid that the kids will bring the disease home. So you see that the fear factor and the unknown puts you in defense. There is the spectrum of Orwellian spectrum that somebody's in town is there to get you. And I think that people, instead of taking responsibility and making decision of their own in terms of saying, well, I think that, ultimately I have to face this guy, I have to face this reality, they are postponing this. And I think that what we have seen throughout history is that when somebody tries to make huge decisions for the whole community, the outcomes are not the best. In history, I think that when somebody makes a decision for the community where the results are optimal, you see that in the avatars. The avatars come very rare in history. And I don't see any avatar immediately now amongst us.
So we need to start taking more control, like you said, and not live in that fear. And Dr. G, do you
So.
with your patients, do you see those issues too?
Absolutely.
Yeah.
You know that just a few days ago, we have a patient coming in, first time emergency patient, and she said, that I'm just surprised that it shows up here because just a minute ago, before I just left my house, I got some information. Don't go to dental offices, dangerous place.
Right, who put that out?
Yeah.
WHO, World Health Organization, put out that you should not be going to your dentist.
Yeah, it's interesting, that, and she came in and told you, you're very lucky that you come today because today, tomorrow, day after tomorrow, we can save this tooth. A few more days, you will be swollen. And it's interesting thing that, that about the control. We are taking control in the office. The minute patient just coming in, we're taking control. Basically, we guarantee that we're doing everything above and beyond to protect the patient.
Right.
That we're doing above and beyond. Whatever the CDC recommend, we just stay much higher, much more, and we're doing much more extensive. We protect our patient, we protect our staff, we protect ourselves. And this is technology coming to help us. That in working in holistic world, a zone used in multiple varieties for the patient right away from the beginning. That we are protected our patient much better than any hospital.
Yeah.
That I don't see so many patient a hospital that patient coming in and putting at least shoe covers. The patient's doctor, everyone. That in our office, we really protecting above and beyond.
And some of the challenges, though, are, again, like Dr. Sonners and Dr. PARVULESCU said, again, because I work in Dr. G's office, I do see that it's that fear that they don't have control, and and then even patients that we call because, we want to let them know that we're open, so like, oh, no, I'm not ready to come out. I don't even want to leave my house. Now, how is that going to affect their immune system? How is that going to affect just the psychological, how that affects your body? It suppresses the immune system.
Yeah.
Right? So,
Sure.
That being said, like in a perfect world, if we had a perfect world, which, I can dream, right?
Really, we don't.
Yeah, we will never have a perfect world. But if as holistic practitioners, the three of you, if you had a position like, say like an organization like the CDC or one of these organizations that can set, recommendations, what would be your recommendations or your general statements, for something like this, as opposed to all the restrictions? What would you say would be a good way of approaching something like this? Dr. Sonners, what do you?
I think like what we've alluded to already in that, first of all, I don't mind not being in that position, because what we were talking about before, one person making decisions that affect the entire population, I don't know that there's a one size fits all option that makes sense for everybody. And so rather than, coming up with what we think might be the best plan for everybody, it's the same thing we do in our office every day. I don't make my patients do anything. my job as a doctor means to teach.
Mm-hmm.
So my job is to educate patients, whatever the issue is. This happens to be obviously a very specific topic, current event, but on all things that patients come in with, my job is to teach them as much as I can what they need to know about what their situation is, give them as many different options as I can think of, some of which include me as a guide or a help through that, and some which don't include me, so that they have the tools and the knowledge that they can use to make the best decision for them. It's not, I can't even imagine that there's an exact protocol, that every single person needs to follow for their own life. Some people, they're not ready to come out into the world yet. Okay. And some people are, and some people, have pre-existing issues that make this a much bigger situation for them, and some people don't. So, people need to know, I think, a little bit more about their specific set of circumstances and how their specific set of circumstances, their health in this moment relates to, let's say, this virus, so that they can actually make better decisions just for themselves and for their families. And so I think rather than creating that fear and stress in all of us, empowering people to understand what's happening, not hiding any information, letting it out there and being transparent and saying, this is what's going on. This is your version of that story. This is your health as it relates to this. These are all the different options that might be right for you and your family. And if, which one feels right for you, and how could we help guide you through that? I think, having people in your life and on your team that allow that type of thought process, I think that's really a place where we, for the most part, where we need to start. I think one of the other issues is that, rather than saying, listen, here's this virus, here's this situation that all of us are facing, and everybody, we have to shut everything down, and, masks on, doors closed. It's a virus, and we can't hide from it. It's going to circumnavigate the globe, because that's what viruses do. I mean, the Spanish flu circumnavigated the globe, and we weren't traveling around the world the way we do now. And so that's what these things do. It's a natural phenomenon for the most part. And we need to learn, and humans have been around for thousands of years dealing with microorganisms. They're part of our DNA. They're part of our world. And building ourselves up to not to be as afraid of, but to be as tolerant and as strong and resilient that we can be, so that as we face these changes in microorganisms, and this was not the first, this will not be the last, we need to learn how to take a little bit more control over our health, so that we actually have the ability to coexist with these microorganisms rather than completely fear the microorganism. And we can do that through education, So yes, maybe there are times when these types of things happen where sheltering is appropriate, or shutting things down might be appropriate. But there's also times where learning how to take care of yourself and what role you can play in your own health and how you could become more resilient, those also play a part in this. And some combination of all of that information mixed with some different options of how to handle it, that would empower people to be able to make, responsible decisions in their life and their family.
I agree with you wholeheartedly. If you notice, I'm shaking my head the whole time. The reason being is because we're constantly, this is my edit, constantly being fed the fear. And I can't remember any time that I saw any news article or news piece saying how you need to improve your health by doing this and this that will help you against the virus. Right. Everything is that don't do this, don't do that, and hide in this and that.
Simple things like, we know obesity has a piece in this that makes it more susceptible. We know that blood glucose levels that are out of balance make you more susceptible. Cholesterol and inflammatory issues and high blood pressure, like there are some issues, right? So some of that we have control over and some of that we don't have control over. But just as important as it might be to say, hey, listen, here are the steps you need to take to protect yourself, from the virus. These are also steps you can take to improve the likelihood, should you come across this virus, that your body can express its natural immunity and deal with the virus in an appropriate way.
And that's why I'm glad that we're doing this, because get that information out, since it's not being put out in the regular media. So, Dr. PARVULESCU, let's if you had your perfect world, I know we don't want to put out regulations for anybody, but if in your perfect world, what would you recommend for people to do during this time?
So I think I would come back a second to what we discussed before and address two factors. One would be indeed to respect the person or the patient and to understand who the person is. The father of American medicine, Dr. William Osler, says that, I do not want to treat the disease. I want to treat the patient that has the disease. So in that sense, this coronavirus visiting the neighborhood, the question is what kind of dialogue does he have with this virus with each of us? So who is a patient that can be susceptible or can develop the disease? So I think we have to have a frank discussion, just like Dr. Sonners says, and not to scare, but try to be mindful and very, very encouraging for the patient and present the situation in a realistic way. The same way that the patient would go to a pulmonary doctor and says, listen, you have emphysema, you smoked. Well, nobody puts the patient on the chopping block. He says, well, we'll give you the flu shot. I don't want you to go out in the neighborhood. I just don't want you to drink perhaps or do some other stuff. So another aspect that I think Dr. Sonners touched upon, and it's somewhat at the heart of the, this aspect of medicine called biological medicine, is that in the understanding of germ theory, the Louis Pasteur branching was that the germ is a bad guy in town and we need to take care of him. At the same time in history, Antoine Béchamp said, the germ is nothing, the terrain is everything. And this goes back to what I said before, that the patient will be the one that will determine how this germ will manifest. In other words, the patient is an ecosystem that will interfere based upon many ways that our own ecosystem can interfere under normal circumstances and under challenges with the environment, and then cope with that. So we have to understand who the patient is and what is the patient's protoplasm. So in that sense, if I was to make a recommendation, I think that we already know from the CDC or other, there are people that have comorbidities and they are at risk. So I think we have to respect that. We know that, things happen where sick people ended up in nursing home. And so, the guidelines became a little bit blurred or so, and what was done for these people. So I would tell the patient that there's never too late. And there are tools that can be used. Some of us, we have in our own toolbox, and the patient can be offered high level of encouragement if that's necessary. But I think it's important to respect the patient and tell them that, they have to do their homework. It's not enough for me to be the Nobel Prize professor of medicine that you come as a pupil in my classroom and you says, this guy has Nobel Prize, he's the best teacher. I said what I said in classroom. You have to go home and to do your homework. And unfortunately, the guy that is a teacher now in the middle of the classroom is scaring everybody. And when people go home, I think that, in the lockdown, you have seen that people, just have gotten, liquors and a lot of other things. They jumped up on the horse, they watched TV, and they ate whatever food they have. So they haven't done anything to change, the predicament or the day-to-day lifestyle. I'm also going to make later on a comment about what's the implication of spending so many hours in front of the computer in terms of, and I don't want to forget that, just remind me if I get lost somewhere, about the importance of what's called inducible nitric oxide and watching computers and how that is important in terms of dealing with bacteria, viruses, and our resiliency to this form of stresses. So I'm going to come back to that.
Okay, now that you've really piqued my interest, we're going to have to get back to that quickly. Dr. G, so, if you had your perfect world, What,
know
what,
that,
what would be one of the
I-
recommendations you would have?
You know, that as a dentist, I'm dealing with periodontal disease. I'm dealing with a patient need to heal the bone after extraction. I need to deal with the infection to heal. I need to deal with the implant to place. And I ask patients, find out what's your vitamin D3 level. And unfortunately, a lot of patients don't know, or they tell, oh, my vitamin D3 level low. And you have to start with something that you know. Because it's like, that your vitamin D3 level low, you need to take it. Because, science shows that the vitamin D, it's very, very important. It's not only for the bone building, but, for immunity and everything else. Everybody knows that zinc is very important, to deal with any diseases. They know the vitamin C, but do they do it? Do they take it? Do they take responsibility? This is absolutely right, Dr. Sonners and Dr. Parvulescu. We have to become teachers. We have to share our knowledge and encourage people to just take care of themselves.
Exactly. And I'm just going to little side note. My son is actually an infectious disease nurse at a medical center, and he has some COVID patients. And he said, Mom, you're going to be very excited to hear that we give our patients vitamin D and zinc. I went, oh my God, I'm so excited to hear that, because I'm thinking they're just pumping them with pharmaceuticals, but they're also giving them vitamin D and zinc. So that being said, with everything that you know about this novel coronavirus, what would be the main thing that you would want the public to understand about it? And I think Dr. Parvulescu kind of touched on that already. What is it that you really want them to understand? You were saying that the body you were saying that the virus and the bacteria, lives in the body, and the body responds to it depending on the health of the body. So what do you know about this novel coronavirus that you would think that everybody should know about that they are not hearing about? Or if there's something you want to touch on and make sure everybody's aware. I don't know if I'm explaining myself right, but
I think so.
Sorry, do you want to jump on in there?
Yeah. I think it's not even what to know about this virus as much as it is what to know about the immune system and our body's interaction with bugs. And, that the idea of the terrain, I think that was a great point brought up earlier. And, to understand, we all know that, there's flu season, and during flu season, there's a higher chance you're going to get the flu than not during flu season. We also know that, we could be in a room of 10 people, one has the flu, that person sneezes on everybody, and 4 more people get the flu, but, the 5 others don't. And so what's the difference? Why do some people get it or some people not get it? And it has everything to do with, not that the few people that didn't get it weren't exposed, because they were absolutely also exposed, but it's about how our body processes the interaction of these microorganisms and how much of symptomatology our body expresses. And that has everything to do with the general strength and balance of our immune system and of the other microorganisms that live in and on us. And so if we take the time to, almost like you're gardening, if you take the time to build a healthy microbiologic environment, we are skin-covered petri dishes. We have more viruses and bacteria that live in us and on us than we have cells that make up our bodies. And if we can develop a really strong and balanced microbiology within our body, our chances of processing pathogens, the bad bugs, is much higher. And when our environment is unhealthy, when we are inflamed, when we're out of balance, when we already have a lot of other pathogens that our immune system is trying to deal with, our ability to process those pathogens becomes hindered. And this is really not that much of an exception to any of those other rules. And so, in this moment, we know that exercise is good for us. In general, most people would agree that exercise is good for us. And there's, multitude of benefits that it might help us with, immune system being one of them. People know that eating healthy is good for us. And that if we eat healthy food, we should have a stronger, more resilient system. People know that alcohol is bad for us. And generally, the more we drink, the more toxic that is. Doesn't mean you can never have a drink, no, but obviously more of a toxin is not as good as less of that toxin, you know? And so, but we also know that stress management, that the more stressed we are, the more likely we are to get sick, and the less stressed we are, the less likely we are. So a lot of us just know that inherently. And then all of a sudden you look at this moment in time where basically gyms are closed, fast food places are at record numbers, alcohol is at record numbers, and stress is at a record high. And so all of a sudden we have this horrific potential for a new virus that it might be more easily contracted because it is new. And so our immune systems aren't necessarily tuned into it yet. And at the same time, we're blending that with higher alcohol consumption, poor food choices, more stress, more sedentary living. And it's a recipe for a tough go for a lot of people. In my own personal life and with my family, and what we talk about in the room with patients is, this is a time where a lot of us aren't commuting. All of a sudden you're not spending 90 minutes in the car going both ways. And, while there are stressors that are out of our control that are higher, there's other stressors that actually might be a little bit more in our control and that we could deal with a little bit differently. And so what a great time this has been, if you look at it, to reset some of the intensity of our lifestyle that many of us in northern New Jersey, we just have a pretty high intense lifestyle to begin with. What an opportunity to maybe reset some of those things and actually take back control over some of those things that we felt like we didn't have control over before, with maybe some of the extra time that we have, and, try to rebalance that. Yet, if we're not having those conversations, the majority of our communities are swayed the other way. And so, I think that's one of the bigger challenges too at this time.
Resetting the mindset. I like the way, because you never thought about it that way. Yes, you have a lot of stress, but we are less stressed in other ways. And right. Taking advantage of that, as opposed to just saying, oh, I'm so stressed, and being overwhelmed by that and consumed that you don't pay attention to the benefits that you've now reaped from this situation. Other than a vaccine, of course, what are your thoughts and recommendations on eradicating the threat of COVID-19? You've touched on it a little bit about immune system. But I don't want to put words in your mouth. So what would you feel would be best for the health of the patients as opposed to getting a vaccine per se? Dr. Parvulescu, I'm going to ask you to get started with that.
So I'm going to start to answer by going a little bit before to what we know and we don't know. And I would agree 1,000,000% with Dr. Sonners, telling people that it's not about the coronavirus, because the honest answer is that a lot of things we know, but perhaps many things we don't know. So there's been many people in the real advanced scientific community that made a lot of arguments about that. But I think to understand that there is no way that we can separate, and this is just to make a more clear specification of what Dr. Sonners says, is that we cannot separate our cell's ecosystem from the bugs that lives within us. So we are a skin that covers, a lot of these bugs, but there is a very intimate relationship between these life forms that we are tagging as bad, and they're there to get us. So if we have on average 10 trillion cells in the body, the common understanding would be that the human microbiome in terms of bacteria in the intestine, or so, it's around 100 trillion, so 10 times more. And we know that we cannot live without this microbiome. And we have an understanding of somewhat understanding about what it means to dysregulate the microbiome. But at the same token, and this is why I say we don't know about that, and this has been, pointed by, the guys that are in functional medicine, and they're just bringing the bench information from the scientific community, and they say that, there is a viral, meaning the amount of viruses that are living inside the body, they're perhaps over 300 trillion. And we don't know what the significance of that is. Now, in that sense, I would say that when you see viruses, my understanding is that at different steps in life, when you're going off the main path, there are adaptive mechanisms that say you're going into a dead end and you're not going to do well. So from within our own body, there are life forces that organize or present themselves as viruses or bacteria that are saying, this is too much garbage or too much problem here, and I'm gonna take this garbage out, and that might end up in pneumonia or somewhere else, but it's a way that the body is using these life forms to detoxify itself. I say this because nature, I think we have to be very humble and to just watch and listen to nature. So if you see giraffe that are eating the leaves of certain trees in the savannah, after a while, the tree starts to poison the giraffe, saying, you know, you took advantage of me for too long. If you're gonna be continuing these branches, there's not gonna be anything left of me. So then the tree, it's putting up these pheromones or exosomes or viral particles that all of a sudden the giraffe, as it has a dialogue with the tree, says, you know something, this tree is poisoning me right now. So what was delicious, 3 days ago, I have to walk away. It's very interesting that not the tree, but rather a whole stretch of the forest has been informed by the fact that this tree is suffering and is telling the other tree down the line that somebody's gonna take advantage of you. And the whole section of the forest is putting out these hormones, pheromones, or different other informational pieces that the giraffe says, it's not a good place for me to be around here. So this form of dialogue in nature, we as human beings, is absolutely clipped and curtailed. And I think that is because an arrogance of humanity that instead of contemplating the wisdom of nature says we can have it any way we want. That is one thing. I also am amazed by a fact of nature that made me perhaps take this trip into biological medicine, where I think you have to observe and you ask yourself, if you put an apple down on the table, if you're gonna put a piece of meat on the table or a chicken or so, and you walk out and you come the next day, according to the laws of nature, this apple or the meat or, I don't know, a leaf of salad or will be composted. And the compostation of that, it doesn't happen because of Professor Johnson or this other guy that lives in China. It's gonna decide how the apple or the meat is gonna compost. The meat is gonna be composted through, most of the time, this gram-negative bacteria. And we know a lot about them, and they live in our colon. And we know that they produce lipopolysaccharide or some other things that they are not well taken by the human body. The lipopolysaccharide in extremely small amounts, creates endotoxemia and a state of shock in the human body. So the question is, what kind of membranes do we have to protect us from that if that is there? So I think that we have to look at nature and to say, well, what is actually happening and composting into, for example, the colon in our garbage bin, according to the laws of nature. So you see that many different doctors, many different visionaries or politicians will start to take, these pieces of information, juggle them around and put tags on them, which has nothing to do with the aspect of laws of nature. And they'll say that, this has good nutrients, this has good calories, this is protein or so. So they are actually clipping out the different fractions, and they become very piecemeal in their interpretation of the food, which in this case is information, and they don't pay attention to what information really is, but rather what snippets of information. Sugar, you eat a banana and they say it has too much sugar, or you eat 3 apples and they say, oh my God, you're really gonna have a diabetic coma, and they don't look at it as information. So I think this is important to look, and this is where the milieu is, this dialogue between how does the body respond to that. So we see very, very interesting that when people are in more advanced stages of acidity, or let's say immunocompromised status, where you have like a more advanced tumor or so, which is something that happens because of how you evolve, because the tumor doesn't come out of the blue. But if you are there, you see that the most of the time it is not necessarily the tumor that you poop out. You say, I have no more energy, and the patient dies. So yes, we know that the patient is consumed because he doesn't have enough energy and mitochondria and poisoning and toxins in the body. But the life forms are more advanced bacteria and more gram-negative bacteria. And then the fungi, which are saying, you know something, you are alive, but you're actually not so much alive anymore. So I can show you here a picture. I can put it here if you want in a second. In mountain lakes where I go mountain biking in the Thorn Park, where after the storm that was 2 weeks ago, the road, the main road, was not blocked. There was a lot of fallen trees in the forest. And those trees were interesting a lot. When you see them snap, 50% of them, they're decayed inside with fungus, meaning the mycelium, and so they're already alive. But when you look at the stem, you see. So here I am going a week later, and there is the road, it's blocked. This huge tree has half of it just snapped off after the storm. So when you see the tree in its core where it snaps off, it has a huge ulceration of fungus inside, meaning that the tree is already, 50% dead. It has leaves, but its stamina. So you see this advance of acidity in life, where these life forms are not there to do anything besides their biological role in nature, which they say we have to compost to bring carbon back in nature. You couldn't go into a forest and you couldn't have spring unless the fungi and the mold are really composting the leaves and the dead trees or so. And this is a cycle how everything turns in nature.
Right, so you're saying living synergistically with the viruses and the bacteria and fungi, like Dr. Sonners was saying also.
Exactly.
But then again, what can we do to so that we're not controlled by them?
So we have to change at that root the biological terrain, which means that the way that you put the information into the body should be according to the laws of nature. And that means that we should have access to clean air. The epidemic that was huge in northern Italy came in an area that had the highest level of pollution in Europe, and the level of chronic lung disease emphysema was 500%, five-fold increase compared to the general population. So when you go to an area that is very, very polluted with stagnant air, and you have a population that lives like kings, you have Italy. Italy is two countries. You draw the line and you tell people, if you want to live healthy, I tell all my patients, I want you to live like a healthy paesano. So move into with the paupers in southern Italy and try to live off the land. Is mostly the simple food of the land, unprocessed food. And the kings, of course, in Lombardy or so, are all, meat, cheeses, acid food, and, alcohol, because they have it, they're rich. So you see where the epidemic hit very hard. So good access to air. And in this sense, I think that, a lot of people come to say, listen, I wear a mask or so. I think we have to, to respect and, and at least say, hey, listen, we have to protect ourselves. So it's a lot of crazy guys that go around, I want a mask, I don't want a mask. And I think that's a bit of a masquerade. So I don't think anybody says, listen, if I need to protect you, I'll put a mask. Okay, I'm not crazy as a doctor to have a flu to cough in your face. Okay, so there's a lot of discussion about that. But the people should know that the main route, which is something that if you ask many doctors or so, and I was one of them, was not quite clear about that, is that the main route of detoxification of the body is breathing properly, and breathing is the main route of detoxification. It is not what you think, like, pooping or peeing, which is a lot of excreta, but rather the bulk of detoxification happens to healthy breathing. And you see that most of us do not breathe the right way. So, if you say, what do you do? So I would tell to a patient that, yes, you can do the Wim Hof technique. So the Wim Hof technique is something that is cheap and anybody can do at home. Wim Hof has cheap. Wim Hof.
Can you spell that? So for those who are listening,
WIMHOF.
So they can look it up.
So look up the Wim Hof technique.
Yeah,
so
it's free on the internet. You may download. He does the free lessons. It's unbelievable. It's great.
Wonderful.
So we alkalize the body. We actually open up a lot of the breathing space. So we create a very good oxygenation of the body. There's some other aspects of it, but this is something that everybody can do. So we know now that, Wim Hof has changed the medicine books, that has shown something that's incredible, that through proper breathing, we can enter in the back door, which yoga was telling us for many times in terms of pranayama, and take control over the autonomic nervous system. So he has shown that in a very high university center, how people that are trained, regular people, not especially endowed like Wim Hof, that you can really get into a state where you can harness the healing mechanism of the body.
Oxygen is life, right? Oxygen is life. That's absolutely.
Yes.
That's why we use ozone and then hyperbarics. I mean, I know Dr. Siren used hyperbarics, right?
Yeah.
How do you use that to help your patients, like maybe in a situation like this? I mean, the breathing in and of itself is going to help, and like we're using ozone, and you have the hyperbarics.
Yeah, I mean they're all different ways. I mean, oxygen. That's probably maybe another call we could do one day. Like
oxygen is life.
Whether it's breathing or ozone or hyperbaric. I mean, oxygen just plays such a critical role in so many aspects of cellular function. From detoxification to energy production to healing and recovery, all these different things. So, and hyperbaric is just one other avenue to use oxygen as a healing mechanism. It has a place with what's going on in terms of COVID as well. But it is a way to help build a reservoir of improved oxygenation to the cells. But just like he said, I mean, I do Wim Hof myself at home. I instruct a lot of my patients to do the same thing. I mean, breathing exercises and improving our own ability to carry oxygen, to get rid of carbon dioxide, and to have proper gas exchange in our cells, with so many of us don't have. Teaching that and practicing that over time, that's critical for sure for this particular respiratory illness. But it's true again, so many things. What should I do about this virus? At the end of the day, it's almost the exact same things I would instruct anyone to do to improve their health. There's such overlap between what I would do for anybody with any condition and what I would do for somebody saying, hey, listen, if I get this thing, what do I do to really improve my health and improve my odds? It's almost with it plus or minus a few percent, it's almost the exact same, process and principles. The only differences between people would be some people have bigger issues over here, so we're going to focus on that. Some people have bigger issues over here, so we're going to focus on that. But the full picture would be very similar, and it's just about reconnecting and rebalancing our system to be more tolerant of our environment. Exactly. That's really what it comes down to.
And like Dr. Parvulescu was saying about reducing the acidity in the body and improving the oxygenation of our blood. And, we do have to live with this microbiome. We have the bacteria, the viruses, and the fungi that live in our system, and we need that balance, but sometimes it gets out of balance. And Dr. G, I heard recently, I thought I saw an article, something about super infections in COVID patients that has to deal with their mouth.
Yeah.
Am I mistaken?
Yeah, but Dr. Parvulescu and Dr. Sonners talk about comorbidities. This article talking about diabetes, that overweight people and everything else. They added periodontal disease because it's an extra reservoir for the bacteria that sit in your mouth, in your gums, and you just inhaling them and you swallow them constantly. And this is interesting for me because now we really just telling patients that you have to take care of your gums because it's
I mean,
going
who
to
would think a dentist, with a virus, it doesn't make any sense. But if you think about it, break it down.
Yeah, it makes sense because, if you statistically, in the medical journals, they put in, periodontal disease, one of the comorbidities, and we can control it. And we really can control it now because technology allowed us.
Right.
This is a big change now because people start understanding this is not a joke anymore. It's something that really protects them.
Right. And again, it's all about protection and how we can boost the immune system, like we were saying before, with oxygen and taking the right supplementation, eating right. As you were saying, Dr. Parvulescu. That's why I said earlier about I started my plant-based diet because I found that no matter what other diet I was trying, it was just not making me feel well. So I personally started a plant-based diet. They may not be for everybody, but again, just eating better and eating cleaner, taking my vitamin D3 supplements, I'm taking my zinc, I'm, doing my certain inhalations of ozone and peroxide and things like that. So I'm doing everything I can to protect myself because for those of you who don't know, I did have a significant medical concern last year, which put my life at risk, but I'm better now. So I do have a predisposition, but I'm not scared because I'm taking everything into my control and what I can do. So if you each had one thing that you could say, one thing that is a must have, like you have to do, what would it be for listeners that you would say is something that would boost your immune system or keep you healthy? Just one thing. Let's go. I'll start with you.
I'm okay, doctor.
Yeah, that I love vitamin D3, and that how much I take it. I would say every patient, take vitamin D3. Make sure that you're on a normal level. Don't go below 30 because it's just kind of strange. If everybody knows the vitamin D3 normal level is supposed to be between 30 and 100, that the patient kind of tell, I know it's low. It's 9, 11, and this is you just take it. It's easy. It's accessible. You can do it anytime, in the morning, in the evening. You may take it twice a day, but do it.
Yeah. And Dr. Sonners, I know you have many, but this is one thing that it's you just cannot live without. You have to have it.
Just to think about the whole, maybe the whole system a little bit differently. What I would say is, learn how to focus on the things that we have control over and learn how to stop focusing as much energy and effort on the things that we don't have control over. There's very few things. I think the one thing that this particular, with the virus and everything that's gone on economically and in our lives around it, I think many people have become, even more aware of how little control we actually have in our life. And that's scary to a lot of people. And that brings us back to the fear and the stress. And so I think that there's some really wonderful ways, and it's really just remaining present, honestly. But there are techniques for trying to understand that, listen, there's only so much we actually have control over. And it's these things that we're talking about. It's whether or not you choose to go for a walk and get some fresh air. It's whether or not you are going to exercise. It's whether or not you're going to eat healthy. It's whether or not you're going to have that drink or not. It's whether or not you are going to watch the news. There's very few things that we actually have control over. And if we put our attention and actually do something with those few things, there will be a tendency to just shift us right away on many levels in a healthier direction. And if we maintain our attention on the things that we don't have any control over, the feelings of overwhelm, the anxiousness, the overall levels of stress, which then leads to changes in your relationships because you're stressed. It changes your sleep because we're stressed. It changes so many other things. So if there was one thing, it would be that. It'd be take back, and really learn to hold your attention on the very few things that we do have control over in our life and do something about those things and focus your efforts in that place.
I like that mindset shift, changing how your thought process. And Dr. Parvulescu, do you have
So there are two
your
things.
go-to?
There are two things. I think that if I had to offer something to somebody that's challenged in a crisis mode, you have, just like Dr. Sonners says, to empower them. And I would say that the main thing that I can offer them in a state of total stress, where the patient says, can I afford to do that? Do I have to do that? Is there anything else I can do that? In a society where everything is about, I must have this, I might have this, I might have this. The answer is that you have to let go of your attachments and you have to start fasting. So fasting is when your mind goes a million miles an hour, is that fasting means that you have to tie yourself up on a pole and fasten yourself there and start moving around crazy in circles. It's time to take responsibility. So the first thing that will allow your immune system to go take care of everything that has to be done is to stop the music and the toxicity at the frontiers of your body, which are the membranes. So you have to shut off the doors, you have to shut off and stop putting food, and you have to start to fast on water. I think that has been used for thousands of years, and it immediately allows the immune system that's now is sitting on the periphery of the 80%, and trying to fend off whoever wants to come inside your ecosystem. And the body has so high level of advanced intelligence that I think that people should start to fast. Now, in that sense, fasting might not be the same for me, for Dr. G, for you, Dr. Sonners, or a guy that has emphysema in 75 years old, where the body resiliency is different. However, for example, if Dr. Sonners come to say, what do you do? I would say, you look to me like a strong guy. I will be with you. I will be in touch with you. I want to know if you're in trouble, but I think you should fast on water. I'm comfortable to tell him that. Okay, so again, you have to address the individual. If you see a guy that's 75, I think you have to tell him that, the soda, the booze, and, the canned food and the meats is something that you don't want to do. So I would tell the guy, why don't you do something that's simple, which I tell my patients, that if you were to be on a trip in India and this was to happen to you and you go to the hospital, all they would give you breakfast, lunch, and dinner is, I haven't been there, but is to have for breakfast, I would say lemon water, which is a great alkalizer, or so is good, and then you can have or just drink herbal tea. And even for lunch, why don't you have rice with the spices, vegetable, no salt, again, no salt, and use khichdi. So khichdi, it's this multi, Ayurvedic herb, contains turmeric and cumin and rock salt and different herbs. That is a very nice harmonizer, if you want, that works great for your immune system and stabilize the digestive system. So here you go and you have this simple, delicious food like yams and mixed with rice, or traditionally they would make it with rice and mung beans. Mung beans being, the one that really soaks up a lot of this garbage from the intestinal tract like a mop and takes it out. On this, so in that sense, for dinner you can have some, a nice blended simple vegetable soup that anybody can afford. So you put the digestive system to rest and you allow the guy, so that would be a controlled medical fast where everybody would be really, really very, very happy. And then you allow their immune system to go now. So I'm telling you, the fasting is something that I would say, stop the music outside, the periphery of your body. Just allow the body to rest, because the number one doctor is not me, it's not whoever wants to sell you that, but it's divine intelligence. And your immune system, if it's allowed to let go, it will do its best job. And when the energy that's spent in the digestive process to try to chop down the food, people should know that the digestion of food and eating more than 3 times a day and snacking in between. It is an on and on and on energy intensive consumptive process where the body's energy cannot be directed in the state of crisis where the problem really is. So that's what I would talk to somebody that says, you must have this, and have that open discussion with them. I cannot tell them to, to go to an oxygen bar, to have hyperbaric or so. There's many other tools. We have those tools. And I think that, if the patient says, I think I need more of a helping hand, and, whoever has those tools, and people, you have to say, perhaps it's not for everybody. If they want to have that, their divinity has to decide. So we have to respect the patient at every single step of our life. It has nothing to do with us being smarter or so. We can open our heart, and my style of practice is always to tell the patient why I would do that. And that's why I tried to explain before. So that would be one thing that I would do. The other thing that I would do is to really mention this here, which is a very powerful statement from the ABC of Chinese medicine, that every single thought is a powerful movement of qi. So meaning that, this is a coronation, if you want, of what Dr. Sonners said before, that patients have their thoughts, and their thoughts have to be put out of the fear and danger zone and say, you are the one, and I'm with you. But I want you to know that the way that you're gonna drive the ship now, I can only steer you, but you're still driving the bus. And your thought will be the one that will direct where you're going, right or left from here. So the director of your body, the body being composed of, 10 trillion cells, and 300 trillion cells, they're not different, are listening to this director. And the director is one thought, which is a very powerful movement of the qi, meaning that the music, the tempo, whatever comes out is how you really are addressing where you gotta stir. So before you're gonna, go right or left, you're gonna have a thought. So all the guy that won the Nobel Prize, and he looks so great or so, he only had a thought, and he put a step up, and then he went to the 5th grade, and then he went to this school, and later on he's coronated. But nothing would have happened without one thought. So emotions are how we read the reality, and that is strongly impregnated our thoughts. So in that sense, living in the fear zone or so, it's where you actually, as a de facto phase, would be the moment that I put you into the fear zone. As I'm saying that you're driving the bus, you're actually sitting at the steering wheel, and you're absolutely frozen. You have absolutely no more power to push the acceleration, to move the steering wheel. You have no more power. And that is devastating for the individual.
And this goes back to what they say, that your mind can heal the body. A lot of people who are in the hospital or whatever, they say change their mindset because they'll help heal the body. My favorite thing I have on my desk is this little meme, and it says, every cell of your body is eavesdropping on your thoughts. So it is so true that, having that mindset shift, like Dr. Sonners was saying earlier, and really focusing on the positive things that you can change and have control over can make a huge difference, as you're saying. So I think that it's definitely sounds like we're a lot of an agreement with
so it's here. All taking, and that means to take kindness unto yourself.
That's right.
Your thought is actually when you're embracing your body. You don't criticize your body because you are, 50 pounds overweight or 200 pounds overboard. It's just with kindness embracing your body. I have to tell you that I never tell a patient to lose 1 pound. I tell the patient to nourish their body, and the nourishing would be what I just said before, a thought before anything else. And then you can put other pieces of flesh on this thought, and then you have a more material aspect to it. But to embrace yourself would be something that immediately, I think everybody likes a nice hug.
Oh, of course. But we can't do that now, though.
Yes, we can. We can.
Yes, we can.
So we should hug ourselves, and I think that's what I would tell my patient.
I like this because it's not about, well, you should do this, and that. It's something that's it's things that we don't think about. And my next question was going to be about, like, in a holistic living, what is the one thing that we're not really paying a lot of attention to that we really need to pay more attention to. And I think that might be it. I think that's the answer right there. That we're not accepting of ourselves and et cetera. And that actually will help boost the immune system, because all the stressors that we have are going to create oxidative stress in the body. And then the whole cascade, one thing after another. So I think something, it sounds so simple, but a lot of us don't do, is changing that mindset, having that shift in that mindset. So thank you for that, doctor. I really think that's going to be very helpful. Dr. G, I'm sorry, you wanted to say something.
Yeah, and we don't take care of ourselves in terms of sleep. It's very, very important, because people don't sleep enough, and, don't rest enough. And, that sleep need to be really, really good. That I had an extensive conversation with Dr. Parvulescu about the sleep and, that necessary supplementation for that. It was beautiful, but, that the sleep and rest, very, very important. Because I try to talk to all my patients after extensive surgery, they need to rest. Rest and sleep, and this is very, very important. That, like Dr. Parvulescu said, that computers and everything else, it's wonderful tools, it's wonderful toys, but that your body needs rest.
Yeah.
I always tell you.
Now he remembered.
I always tell you, put your in the kitchen.
Yeah, so thank you for that. I think that is critically important, because the only way to step into the repair zone is to say, listen, shut off the light and let the body go into total repair mode with whatever melatonin, whatever comes there. So there is something that stuck to my mind, and I'll never forget. I want to echo that here. So there is an Ayurvedic practitioner in the United States, Dr. Kate Stillman. So in an interview, I heard this doctor, talking to different people, and she says, listen, I want you to go to bed early, sleep before, let's say 10 p.m. I want you to sleep. And the patient says, but I have to do this, but I have to do this, and I have to do this. And she says, I understand, but I ask you to sleep because you tell me that you have so many problems. It would be like somebody saying, hey, I need energy in my phone because I'm on the road all the way, and I need battery. And this is my livelihood. I have to operate and communicate with people. So what do you need to do? You need to charge it. So if you want to power charge your phone, I would say 80% is charged between 10 p.m. and midnight. So why don't you turbocharge your phone and then trickle to have energy when you wake up in the morning, says, oh my God, I have 100% battery. You're happy about that. Imagine that you wake up in the morning, you're on the road, and your battery is 10%. You know very well that you're going to be in total crisis mode at the time. So you will be a mess. You're not going to be able to do, you're going to be in total crisis mode. So this lady that I was telling you before says, okay, I want you to sleep. I can't this. I say, well, suck it up. You know something? That I just said that you should make a change and try to optimize sleep. You say you don't want to charge your battery, but when you wake up in the morning, you're crying and you have a total blowout because you're in crisis mode. I say, why don't you charge your battery? So I think that this dialogue has to happen with the patients to say, if you are somewhere, you have to do something about it, and you have to take responsibility about that. So sleep is confiscated. Great, Dr. G, I like that.
Very good. So that's it about turning off your computer, shut off your cell phone. Don't even have it in the bedroom. Make sure it's in another room. I know Dr. G does that. Yeah. And when your alarm goes off, don't keep hitting the snooze. I fully admit it. So you don't want to do that. So thank you very much for that tip. Now, if by chance, towards the end of the webinar here, I'm going to ask, if by chance, if somebody does, unfortunately do get the, catch the virus, what are your recommendations, what they can do other than, of course, the medications, that, people are promoting that are helpful? What would be a recommendation that you would offer? And Dr. Sonners, what's one of the thoughts that you may have?
So, same thing. Obviously, the more homework we do today to prepare our body to be in a better place for that day when that day comes, obviously is going to set the stage for a better outcome, I think. And I don't know that this is so different than other immune issues that we've had in the past. So there are certain, if it's become controversial to say that there are certain nutrients that your body requires to function properly. I don't know when that started, but I know a lot of healthcare practitioners are getting in trouble for making recommendations. Simple things like vitamin D. I mean, there's enough research on vitamin D that, if you're deficient in vitamin D, your immune system is going to struggle. And if you're sufficient in vitamin D, your likelihood to get through something like this is much higher. So that should not be controversial to say that. The same with, in this particular case, so vitamin C has been shown to be effective for this. Zinc of different kinds has been shown to help be effective with it. There's a handful of different herbs that are immune stimulating that have been shown to boost our immune system to get a little bit more activation from it. There are some basic, inflammation modulating herbs, things like you mentioned before, like turmeric, or others that can help reduce, the inflammatory response of the body. But ultimately, just like every virus or every bacteria that any patient or myself or my family may have, we listen to our body. We allow the body to do what the body does, and that is to fight infection, to heal, to recover, giving you that space to sleep. I mean, that is when we heal and recover. It's hormonally, the amount of chemicals that our body releases overnight to promote that healing and recovery is critical. So getting that extra sleep, nourishing ourselves appropriately to tolerate this virus. People say, like, why I'm okay getting the flu. Okay. So patients are, why do you want to get the flu? I don't want to get the flu, but every time my body fights an infection, it's better at fighting the infection. And, so encouraging, I'm not a big proponent of treating symptoms of being ill as much as providing the nourishment of the body to do what it does. And so when we listen to the body, when we have an idea of what the body is saying that it needs, we provide the environment and the tools that the body requires to do what it does. Our ability to transition through this, especially if we have no other pre-existing issues, our ability to transition through this should be, relatively seamless. So,
right.
that's typically our recommendations.
Yeah, because you have some people who had extremely mild symptoms and they didn't even realize they even had it. To
Right.
those who, unfortunately, it's mortally, it's death sentence. And it all has a lot to do with how the body is prepared, I would think, and also the comorbidity. So again, having that controlled mindset, like you were saying earlier, making sure that you can control what you can. I can't control the virus out there, but I can control my body.
Right.
So, Dr. Parvulescu, what's your thoughts on that?
So when you are with the back against the wall, I think that you have to absolutely help the patient. So there are doctors that have done quite some wonderful work with intravenous vitamin C. I think that is a great tool, and I think oxidative therapy. I have an email from a traditional 100% allopathic hospital from Ibiza, Spain, with everything that the chief of anesthesia and the doctors have said that in absence of any other therapies, we offered with the general acceptance of the government of Spain in intravenous ozone major autohemotherapy, and not being able to offer anything else to those patients, at least under those circumstances, 2 sessions. So I want to quote that the 2 sessions of ozone, not only that has spared intubation in this patient, but those patients did not even need oxygen supplementation. So there's, I think that we look at nature, we look at other people do, we have to be humble, and we have to say, if I have something to offer to you, then, oxidative therapy in form of ozone therapy is considered one of the safest ever. patient can do, rectal ozone. That also is very powerful for many things, but that can be used. But this variety of therapy has been used, and I think that could be offered. Something very delicate is that when the patients are sick, we have to see actually what they communicate to us and what is the significance of their symptom. So when the patient has a high fever, so for example, if they have influenza and they have a high fever, the first thing they'll say, well, do this, and take some Tylenol. So I am actually listening to what the patient says. The patient says, I have a fever of 40. Well, if the human body has this formula inside, and the body says, I need to deal with you. You're inside my house. Then one of the ways that the body defends itself, saying, okay, I can cut this guy, chop this guy up if I increase the temperature to 40 degrees. So the body has very advanced, intelligence, and then you're gonna start to shiver. So the body says, okay, I'm gonna run a marathon very fast. I'm gonna start to sweat and create so much heat that the core temperature comes 40, and then this intruder has less chance to win over there. So what the patients told me when he had a fever is that his immune system has been told, cytokine, these chemicals, you have to create this very hot environment. So that's what the patient is telling me, that their immune system is working very, very hard. In that sense, there is one thing that if you say, well, I'm gonna go to Paracelsus, one of the first things that they'll do is say, well, I'm gonna, possibly induce a fever. And that's been perhaps recommended, to say, hey, we need to increase your metabolism, your metabolic fire. And many people that cannot mount a fever, they end up with very advanced diseases or so, because they cannot really, get their immune system to do the job. So the call for fever is a call for health. That's what the body is telling us. So I go always to Hippocrates. So may food be your medicine, medicine be your food. All the diseases start in the colon. I'm going to jump into this just in a second, very short, because it's something that I would offer, because I mentioned oxidative therapy and vitamin C, and I'm going to say enema. Okay, and so enema with ozone, for example, would be a wonderful way to clean up the garbage and give a big boost to the immune system and to the liver and detoxify the body. And so enema would be another thing that would be great to do when your house is burning. And going to one of the pupils of Hippocrates is Parmenides. So Parmenides in ancient Greek says, offer me the chance to create a fever and I will heal any disease. So that's what this hyperthermia is, such a powerful tool that the body uses. And if it can't create a fire inside, it's an intelligent fire that is a whole corralling of the immune system. Everybody says, well, somebody got inside our house, we have to clean it up, and we need the right tools. So this is what the body is telling us. I have a fever, and I'm listening to that. So that means to treat the patient, support the patient, and don't treat the symptom. So
because that saying, starve a cold, feed a fever, but I don't know how that goes, but yeah, it's the body's immune system trying to work, and we automatically want to squelch it.
That was gold what you just said. Yeah, start the cold, start to fast, and feed a fever. So that's so popular wisdom. Popular wisdom is inspired by nature. It's just amazing,
Exactly. And Dr. G, I think will agree with you with the ozone, because that's one of the reasons why we're using it with our patients more so now than we were before. Dr. G, I don't know if you want to talk about that a little bit.
Yeah, we're using ozone now for every patient coming in. We just make them just rinse their mouths for 1 minute with a freshly made ozonated water. And all our patients has ozonized through their nose during the procedure. We want to just make sure that everything is fine. And I want to just mention that I cannot give the advice to the patient because I don't have as much knowledge as Dr. Parvulescu, but this is what I do. If sometimes I run into fever, I sometimes get the flu, that the first thing is stop, that as you go to bed, no medication, no Advil, no Tylenol, nothing. just hot water with lemon, and that not eating. And if I run in the fever, I run in the fever. Usually it's one day, and the next day I'm absolutely fine. This is what Dr. Parvulescu saying to our patient. I experienced myself a few times in my life, and it works for me.
Well, it's
And
like
ozone
you
is
say,
a
like,
wonderful modality, that we're using extensively in the office, and it helps us to protect ourselves too. Because every staff members in our office at the end of the day, breathing with ozonated air, that ozone running through the oil, because it's ozonite, and they're breathing themselves every day, 10 minutes, ideally through the lunch, 10 minutes, and ideally at the end of the day, protect ourselves. This is, we're doing the same for our patient. Every procedure, we're putting patient through the ozonite.
it's all about being proactive, not reactive.
Yes.
Right? So now that we're going to try to start wrapping this up, and it sounds like we're all pretty much on the same page. So I think what's the thing that we've learned the most about this whole experience that started probably sometime in March? I know it was before that, but the shutdown and everything, and patients' experiences and what you speak of experience personally or with your patients, like what have we learned, or what do you feel how we can move forward from this whole experience? Like, what's our takeaway from all this? Like, what can we improve or change or enhance, I guess, moving forward from living through all this? So Dr. Sonners, let me ask you.
Maybe, and this kind of just summarizes, I think, the whole conversation, maybe.
Right.
This is not the first pandemic. This will not be the last. I think in many ways, it could have certainly been much worse than it was. And who knows what the next one may bring us. But I think what this has shown me, and I think it's shown a lot of my patients, and I'm sure most people, if there was ever a time to say, we all have reasons why we either choose or don't, how well or not we take care of ourselves. All those things we were talking about in terms of the different decisions we make, the different stressors in our life, the different choices that we're making every day about how well we're taking how seriously we're taking our health, and how well we're taking care of ourselves, and how proactive we are in that process. And, for many of us, unfortunately, there's a tendency to wait until we get this terrible illness, whatever that is, before we say, oh my God, I should have been. I wish I did. God, if only I. And but this is one of those times where it wasn't like one person happened to randomly get some illness. This is a time where all of a sudden we're all being exposed to this new and different organism, that has the potential to hurt everybody. And as a collective community, we're all saying that same thing. Oh my God, what could I have done? I can't believe how susceptible we are. Like it's a huge reality check to something that we can't see could be so devastating, to our life in so many ways, both physically in terms of our health, but also, economically and other. And so, now more than ever, I think there needs to be this understanding that anything like this could happen again at any time. And, maybe next time, maybe we were a little luckier this time, and maybe next time we won't be. And, all these little things that we're talking about today, what's your plan, right? We all say, our health is our most important thing. And, we can't take our health for granted. And yet almost all of us do take our health for granted until there's all of a sudden this moment in our own individual lives where we realize how susceptible we are. And I think this moment might be that collectively. And, we need to really say, what is that plan? What can I be doing? How important is my health, and am I taking it for granted? And what steps do I need to take individually to make sure that next time this happens, I won't be afraid. I won't stand in fear. I won't hide. I'll come out and say, listen, I know I can, my body is able to tolerate this, and I can move on and move forward. You know, the only, you know, I keep saying that it's a, you know, it's a virus. You can't actually hide from it. The only way that collectively as a community that we can get through this is to literally go through this. And if we do that together, and if we do that and we spend the time that we need to build ourselves up, we can get through this. We will get through this. And hopefully, if we stick with that, we could be in a different place next time this comes around, so that we don't have to have the same type of reaction.
Very good. Dr. Parvulescu, your thoughts?
So I'm going to say very simple. And then if you allow me, I said, remind me about something in the end. I'll tell you about the wireless and about the, you know, spending time on the computer. So the take home message is, every single day, COVID-19 or something else is a test for your body. In this sense, you have to take responsibility and tell the patients that somebody's at your door. This day is COVID-19 and he will challenge you. It applies to me, to everybody. I think that is a biological reality. You can put any hat, call it whatever you want. And depends on many endowments and how you live your life, you might be able to deal with this guy more or less. So always people say, well, show me the money. So Nobel Prize in Medicine, 1998, discovery of nitric oxide. So nitric oxide, small molecule, milliseconds, opens your artery, helps you have, I don't know, normal blood pressure, good erection, whatever you want. Then you're talking about mitochondrial nitric oxide, which is the same molecule that will linger for days for the mitochondria to deal with an energy crisis. And then COVID-19 101 is that when a virus is knocking into your body, you have your immune system, innate immune system, that immediately will produce nitric oxide specifically to deal with this virus, whichever one it is. If this is persistent and the body is challenged on and on, this nitric oxide that can linger for weeks, days, and months, it's very poisonous for the body. It's called inducible nitric oxide. It generates something called peroxynitrate, which is a very nasty stuff in the body. If you don't have enough glutathione, which is the last molecule that repairs the body, then the body says, I'm not going to produce this nitric oxide. Leave the virus do what it does. I don't want to smoke the body with nitric oxide, peroxynitrite, because there's no more glutathione to detoxify that. So
on that thought, I'm going to have you stop. Dr. Jason, unfortunately, he has to leave us. I can't thank you enough for being with us tonight. We're honored, and we appreciate all of your knowledge.
I appreciate being here and sharing this conversation with all of you. It was really,
yes.
it's great.
Thank you so much, Doctor, and be well and be healthy.
Thank you so much.
Be well.
Thanks, Doctor.
All right, I'm sorry, Doctor. I want to make sure I said good night.
Very simple. So here's your nitric oxide that can be your defender. And then if it's too much smoke and the body can deal with that because you don't have enough glutathione, then you go into antibodies and a very, very nasty situation where a lot of things get very complicated. So live healthy. Your body can do, produce glutathione. Don't waste yourself out. So a patient has to take responsibility. In that sense, this is biology 101. Is that wireless increases drastically the production of inducible nitric oxide. So that is a major, major aggravating factor for the overall biology of the body. It will deplete your glutathione. That's one thing to understand. Another thing that creates tremendous amount of nitric oxide is to spend hours in front of the computer, and possible chronic trauma in the neck and strain creates inducible nitric oxide. So spending many hours in front of a screen and just being like that perhaps put extra strain here. And that is also another way that, you say, well, I'm spending many hours in front of the computer, but that particular posture or so, it just creates perhaps stress in the neck. So that is something that, perhaps to the yoga and some other form of movement or so, it's just really, really loosening up that area. So a lot of these people that spend many hours in front of the computer, they have anterior neck subluxation. And then you see how that really affects very nasty the overall biology of the body. So we have to take responsibility.
Yeah,
and we have to
exactly.
tell the patients that anything can happen anytime to each of us. So we have to be kind to ourselves and really treat ourselves nice. So lifestyle factors, that's what it is.
Exactly. And it sounds like being more mindful of ourselves, just being more mindful, not just living remotely and just being on automatic and just doing our routines, but actually really pay attention and be more mindful of everything, our thoughts, you know, are what we're putting into our body. Because like you said, it is a temple. We have to treat it as such. And a lot of times we just, I get home from work, I'm tired, and I'm just going to grab any old thing that the kids ate, and, you know, and it creates havoc in our body. So, you know, the cleaner our body is, the healthier it is, the more the immune system will prevent us from disease. So, and Dr. G, and your final thoughts.
My final thoughts, you know, that knowledge is a power, but you have to put it in action. This is my final thoughts, because it's wonderful that we know, wonderful that we're educated. It's just take responsibility for yourself, for your family, for people who are close to you, and this is very, very important. Just take responsibility for yourself.
Wonderful. Now, at this point, if there's anybody that has any questions for the doctors, we'll definitely entertain those now. And if not, you know, we'll call it a wrap. So just let me know in the chat if there's any questions. I'll be happy to ask the doctors. So I have to say, I learned a lot, and things that I didn't even know, I was like, you know what, I forgot about doing that. I'm going to try to process my life and try to get those done, because sometimes my life is busy, it's tired, you get home from work and you're like, I don't want to worry about it. But then, like you said, Dr. PARVULESCU, that, you know, taking time to really care about yourself and paying attention and love yourself, and not say, I don't care what my hair looks like, I look like heck today, and who cares? No, it's, you have to care. And I think that makes a big difference, just in your mindset, which will help the body process better. So that being said, I think we're a wrap for tonight, and I have to thank you both, and also Dr. Sonners, for the great information. I hope everybody learned a little bit, or just piqued their interest in wanting to learn more. If you want to learn more, you can always reach out to either Dr. PARVULESCU, he's in Madison, Dr. Sonners, his Wellness Center is Core Therapies, and of course, Dr. Gashinsky, who is a wealth of knowledge at the Holistic Dental Center in Millburn, New Jersey, will be happy to answer any of your questions and give you more information of how you can enhance your lifestyle here in a holistic world. So I want to bid you adieu, and I wish you peace, be well, and be healthy.
Thank you, and the same to you, and thank you for having me here.
Be well. I do have one question. Should we approach protecting children in the same way?
I would say yes. The fact that children are having a strong cellular immune response because of the thymus, which is so dominant at their age, this is something that starts to peter out at 60 years old, the cellular immune response, and that's why you go into the crisis mode with chronic, severe susceptibility to viral infection and tumors or so. But kids, you have to sponsor their immune system, and for that they have to have access to good water, they have to sleep properly, and then, you know, you have to nourish the kids. Nourishment is not because you're 25 or you're 55. I think that, you know, an animal it goes in nature and eats what's in nature, eats what's in season, eats what's available. You know, and that's where we all so smart to have different diets. I don't think we shouldn't have diets. I think we should nourish the body. And that's why there's so much confusion. And that's why, you know, there's problems. So
Very true.
So yeah, and kids need guidance. You know, elderly people need to gravitate around us because they get lost, and the kids need guidance. They get lost and they need guidance. So this is a cycle of life. So we have the STEM because we're a little bit more mature and we can make more, you know, informed decision. We have the experience, and then we offer support to the youngsters, and then we offer support to elderly people. and that means to assume your biological role for your particular period in your life, and kids, of course, impregnate based upon what they see at home. So, you know, they are in a state of walking dream state until they're 7 years old. We can go in terms of saying what different, you know, aspects of providing, you know, care for children or so will do to the branching also of the brain that happens so, you know, strong until they're 7 years old. So yes, kids need special attention. And I would say, you know, Hippocratic oath, first no harm. That is what I'm trying to do whenever I give an advice. So kids are totally under our umbrella. So first no harm.
Exactly. And as a mom myself, even though my baby is 28, I believe that, you know, if we start them young with these good habits, and, you know, good water, and not drinking the soda and the pop, and eating garbage foods, and, you know, we have clean foods in the house, and having them learn that, you know, eating good foods is normal and eating the other stuff is not, as opposed to their friends eating the junk foods. I think once they are learning that as a very young child, that just becomes the norm for them. And as an adult, they're going to have a healthier lifestyle in and of itself without even having to be forced. So I think at this point, I appreciate your question. I think we are now going to adjourn. And again, I appreciate you both very much. I am truly blessed and honored that I get to do this. This is so much fun. And I look forward to speaking to you again soon. Hopefully we can do this again at another time. And thank you again. Have a great night and be well and healthy.
Wonderful
Thank
night.
you.
Thank you.
Thanks.
Be well.
Have a good night. Bye-bye.